Welcome to Pharmative Live, and we're coming to you live from Palm Springs, California. My name is Dr. James Partyka. I'm your host. I'm a oncology research scientist, clinical pharmacist, and the founder of Pharmative. And Pharmative is all about connecting patients with healthcare professionals and scientists in order to educate ourselves, to exchange information so that you can make informed decisions with your healthcare providers and family members. So that's Pharmative Live, and Pharmative Live is coming to you from our sponsor, which is the PNN Plus Health mobile app. You can download your mobile app today at your Android and Apple stores. And there's lots of great information in the PNN Plus Health mobile app. I love the app. Alan loves the app, and Jimmy loves the app too, and I'm sure you're going to as well. Not only do we have a lot of healthy news, Pharmative Live, as well as a number of healthcare vital resource tools, but we also have great music, entertainment, retro TV and cartoons, as well as classic films. So that's PNN Plus Health mobile app, and I see a number of people already online, and I just want to shout out to all of you out there. You can text your live comments and questions right now here at Facebook Live through Pharmative Live, and you can also send me your questions ahead of time through info@pharmative.com. Anyways, today's topic is all about what we don't know about COVID-19. But in order to be able to not answer those questions, I also need to talk about what we do know about COVID-19 and exchange some information and facts with you, and then finish off with some questions. But I did receive 2 questions this past week. One was from Jane out there in Florida, who basically wanted to know a little bit more about Pharmative and PNN Media. And I said, well, all you need to do is go to Wikipedia and search for either KLPS19, PNN Media Group, or Pharmative, and you'll get the entire history about how Pharmative and PNN Media came about. And Pharmative and PNN Media together have been streaming information programs as well as news and entertainment for over 20 years, both on the internet and on the internet radio. And that brings us here to today, where we have Pharmative, which is all about healthcare and sharing information about healthcare and healthcare topics. And that brings us here today to Pharmative Live. So that was the first question. Then the second question that I received was from Carol from Massachusetts, who wanted to know, now that we have vaccines, when can I expect to return to my normal life? And that's a little bit harder question to answer, Carol. But to put it in one sentence, I would say by the end of next year, we should be returning to a more normal way of life. By that, I mean going to work and schools, social events, going out shopping, and all of those things that we can do with some restrictions today by practicing, wearing our masks and social distancing. But with the release and the emergency approval of now 2 vaccines, we should, by the summertime, most of us should have received our vaccinations, and we can look forward to a point in time where we return back to a normal life somewhat at the end of next year. However, that is an unknown. And the reason it is an unknown is because we don't know the level of success that we're going to have with the current vaccinations. And we also don't know how the virus will continue to spread as mutations of the virus are emerging. And we're going to address that in a little bit more detail. So I'm going to come back to your question, Carol, at the end of today's topic. And again, Pharmative Live, we basically have about 15 to 20 minutes to discuss various topics, and today's is part 5 of Crushing COVID-19, what we know and what we don't know. Okay, it is December 20th, 2020, and unfortunately, I report to you today that there have been in the United States 17.6 million cases of COVID-19 and over 315,000 deaths associated with COVID-19. And if you do the math, the crude mortality rate is 1.8%. So that means that approximately 2 out of every 100 people who contract the virus unfortunately die of the virus. And we know that there are short-term complications, primarily fever, shortness of breath, loss of taste and smell. You can also feel fatigued, muscle soreness. But the immediate complication, which is life-threatening, are the pulmonary complications and respiratory failure, which can result in the death of people that contract the virus. The long-term complications are somewhat unknown, but we've already identified pulmonary scarring, lung scarring associated with the disease and the response to the disease, cardiac toxicity, neurotoxicity, including confusion and chronic fatigue, clotting disorders, and a number of others as well. We'll learn more about the long-term complications as we continue to study those people that contracted the virus. We know today that it's highly contagious. We know that it's associated with both mortality and a significant amount of morbidity. Last week, we talked about what herd immunity means. And I just want to refresh your memories that when we have an outbreak, an infectious outbreak, such as the COVID-19, that when enough people have immunity, whether that's natural immunity from contracting the disease or artificial immunity by receiving the vaccine, when enough people have immunity with their own immune system generating antibodies that can fight the virus, then the spread of the disease lessens greatly. So that's what we mean by herd immunity. And experts in the field say approximately 70-75% of the population that have the antibodies would be sufficient to minimize the spread of the disease. So that's our target goal. We'd like to achieve approximately 75% of people in the world and in the United States to have immunity against COVID-19. So that's a very ambitious goal for us to have, but it's a necessary goal in order for us to be able to reduce the mortality and the morbidity associated with COVID-19. Now, if you do the math and you look at the number of cases in the United States, and unfortunately you subtract out the 315,000 people that we lost due to COVID-19, and you divide that by the population of the United States, then approximately 5.3% have natural immunity to the disease. So those are the people that are living, that have been exposed to COVID-19, have recovered from COVID-19. Those are the people that we know about, and when you do the math, about 5.3% have natural immunity. Now, there are some unknowns associated with this. Some people are carriers of the disease, are asymptomatic, may never have been tested, so we don't know those numbers. Again, and we're doing some crude estimates, but to the best of my ability, when I've looked at the numbers, approximately 5.3% have natural immunity. We don't know how long that natural immunity lasts. So the recommendation is, even if you had COVID-19, to get the vaccine. And if you have questions about that, talk to your primary doctor, talk to your healthcare team, and make informed decisions about this. I mean, there's possibility of measuring your IgG antibodies to look at that level and understanding how much immunity you might have. But the recommendation generally from the CDC is for anybody, except for the people that are contraindicated, to get vaccinated. We're going to talk a little bit more about that shortly. So, one important point to make. I stated to you last week and this week, our goal is that 75% are immune to the virus. The only way we're going to get, in a logical, scientific way, from 5.3% to 75% is to vaccinate. And that's going to mitigate the spread of disease, minimize the spread of disease. Okay? It's absurd and ridiculous for politicians to promote natural herd immunity. Because to get from 5% to 75%, a lot of people will die and suffer. That's why we need a vaccine. That's why when the vaccine is presented to you, you need to get the vaccine. If you have questions, you discuss it with your primary physician and pharmacist in order to make an informed decision about what might prevent you from getting the vaccine. But look to reputable sources to get your information from the FDA, from the CDC, from the National Institutes of Health, from Dr. Fauci, and reputable news outlets and our public health officials to get the information that you need on when and where you should get vaccinated. And if there's a possible contraindication as data emerges for you not to get the vaccine, we're going to discuss that in more detail. The good news is that we now have 2 vaccines that have been approved by the FDA for national emergency use to prevent you from getting the virus and preventing the spread of disease. Okay, there's an important point to be made there. So again, they're approved for you to prevent getting the symptoms of disease. We're going to come back to that. There's 2 vaccines, Moderna and Pfizer-BioNTech vaccine, which is a partnership between Pfizer and a German company, BioNTech. They're similar, and all you need to know is that they're equally efficacious, approximately 95%. All right, so they're equally efficacious. They're very similar. They're both messenger RNA vaccines. The dosages are somewhat different, and they're administered one 3 weeks apart and one 4 weeks apart, but they both require 2 doses. So it doesn't matter whether you're offered the Pfizer-BioNTech vaccine or the Moderna vaccine from the information that we know today, because they're similar in efficacy and they're similar in their side effect or profile. It's the pharmacists out there, the pharmacy technicians and the doctors and the nurses that are out there that will take care of that rest of that information. They will take care of the storage, the distribution, the preparation of the vaccine, the dispensing for you to get the vaccine, whether that's going to be at your clinic, at a hospital, or at a local pharmacy. Those vaccines will be slowly rolled out and more available for you to get the vaccine. So listen for public health official statements, again, on when you can get the vaccine. Right now, the vaccine is being prioritized, and the healthcare workers and the senior citizens have the highest priority, and then it eventually will be rolled out to other people in the United States. Okay, there's a warning on the Pfizer-BioNTech vaccine. I'm going to be talking mostly now about the Pfizer-BioNTech vaccine. And the warning is those people that have severe allergic reactions, caution should be noted when getting the vaccine. Now, what does that mean? Certainly, if you have a severe allergic reaction to the first dose of the vaccine, then getting the second vaccine would be unadvisable. Certainly, you need to discuss this with your physicians and your pharmacists and your nurses on whether it's appropriate for you to get a second vaccine. There's a question out there. Is it possible I only need one dose of the 2 doses? And the answer is no. We really don't know, but the studies were designed for you to get 2 doses, separated by 3 or 4 weeks, depending on which vaccine you're receiving. The 2 doses, the second dose is a booster that will give you the full immunity against the virus. So whether or not you should get just one of the 2 doses, the answer is no. The studies were designed for everyone to get 2 doses separated by 3 or 4 weeks. Now, when we talk about severe allergic reactions, we need to know what's in the vaccine. And you can Google this. You can go to the FDA website and get the ingredients to the vaccine. So the ingredients for the Pfizer vaccine are the following. It contains messenger RNA. And what's interesting about the vaccine is it's incorporated in what I like to refer in layman's term as a fat bubble, that lipids are used in a concentration to incorporate the messenger RNA within inside what is called a fat bubble, or in technical terms, a liposome. So, getting back to the ingredients of the vaccine, what's contained in the Pfizer vaccine is the messenger RNA, lipids, which make that fat bubble. What's also contained is polyethylene glycol, phosphocholine, phospholipids, cholesterol, a chemical called ditetradecylacetamide, potassium, sodium, and sucrose. So again, those are the ingredients. If you've ever been told in your medical history that you may be allergic to any of those ingredients, the red flag that comes out to me as a pharmacist is polyethylene glycol, ditetradecylacetamide, and possibly, and I don't know the answer to this, the messenger RNA. I don't know whether that is possible to cause severe allergic reactions or not, because the vaccines are so new. So again, you need to discuss that. If you have any kind of history of severe allergic reactions to medicines, then it makes sense for you to discuss that with your primary physician, or if you have an immunologist, and discuss getting the vaccine and the ingredients in this vaccine or the Moderna vaccine or other vaccines that are under clinical development prior to getting your first vaccinated shot, and certainly be in an environment that it can accommodate severe allergic reactions, whether epinephrine pen is necessary or not. Certainly close monitoring for everyone for 15 to 30 minutes is advisable. It's important to know that we have at least 3 or 4 other vaccines under clinical development. How they compare to the Moderna and Pfizer vaccines, we don't know. There's not been any randomized trials comparing one vaccine to another vaccine. So really, all we can do is go by the phase 3 data that we have on the Pfizer vaccine. We can compare it in a non-statistical way to the descriptive data we have for the Moderna data. We think they're very similar. There are no studies that compare the two, and there are no studies that compare one vaccine to another vaccine in clinical development. So we just don't know, but we do think that the 2 that are approved, Moderna and Pfizer, are very similar in efficacy and similar with regard to their side effect profile. Okay, I talked about our goal is 75% to get of citizens in the United States to get vaccinated. And that would give us the ability to reach a certain level of herd immunity through the vaccination process to mitigate the spread of the disease. what we don't know, okay? We don't know about how these mutations will affect the efficacy of the vaccination. We don't know if it will be causing more mortality, morbidity, or less. We do know that the virus that's mutating is more contagious. All the more reason to follow your public health official guidelines of wearing the masks, practicing social distancing, avoiding crowds and large gatherings, especially at holiday time, stay home when possible, work from home when possible. If you think you have symptoms of the disease, fever, sweats, difficulty in breathing, fatigue, get tested. If you think you were in contact with someone who's positive, self-quarantine. If you test positive for the disease, self-quarantine, get in contact with your doctor for advice on how to manage your symptoms. Okay. Even once vaccinations get well underway, you still will be required to wear a mask in public, to practice social distancing, and do all of those other precautionary measures. Because again, so many people have not been vaccinated, all right? Now, another question that we don't know the answer to, the way these phase 3 trials were planned was to look at the emergence of people that have the symptoms of the disease. We don't know once you're vaccinated whether you can spread the disease or not, and that is being looked at right now. So even once you get vaccinated, it will take time for you to develop the antibodies. It will take at least 2 weeks after the second dose. So now we're talking about 3 or 4 weeks separating the first and the second dose, another 2 weeks on top of that. So we're talking about, 6 weeks or so before you develop immunity, and we don't know whether you can continue to spread the disease. So everyone in 2021 will have to still practice those precautionary measures, because wearing a mask, we know, stops the spread of the disease. Practicing social distancing, we know, stops the spread of the disease, and it's going to take at least a year to get up to 75% herd immunity, again, to mitigate the spread of disease. What else don't we know? We really don't know how much vaccine supply we're going to need. We know what it's going to take to vaccinate the United States, and we know right now we're coming up short with the number of doses needed to vaccinate as many people as possible in the United States. But we also have to be aware that we need to vaccinate the world in order to get this virus under control. I mean, we live in an age where we're constantly traveling and traveling from one country to another country, and we have an international economy. So we need eventually enough vaccine for the rest of the world. Europe is well underway with vaccinating Europeans, Asia as well. We need to continue to reach all of the countries in the world in order to get the virus under control. That means we really don't know how many doses will be available. We know that there are other vaccines in clinical development. Hopefully those will be as efficacious or similar efficacy. Again, but they have not been approved. We know we're short now. We have to manufacture more vaccine, and we have to more clearly define the distribution of the vaccines, not only in the United States, but in the rest of the world. Okay, special populations. We don't have any data in pregnant women, and that's because pregnant women were excluded from the pivotal phase 3 trials for both vaccines. We don't know about breastfeeding your child and receiving the vaccine. We don't know about children, although those studies are being planned right now, and we'll use bridging studies to bridge a special study for children to what we know about the efficacy and side effect profile in adults. But we don't have any data. Again, both trials, the Moderna and the Pfizer trials, were conducted in adults. Minorities and special populations. We don't know how well the vaccine works in Latinos and Blacks, although there was a diverse population for the phase 3 trials. More and more data will be analyzed and released as to the special precautions for special populations. So again, we just don't have the data published as of yet. But within the next few months, and for the 2021, we will receive more and more data about these special populations. But right now, all adults are recommended to get the vaccine. Again, unless you've had a severe allergic reaction as part of your medical history, you need to discuss it with your primary physician first, and you need to receive the vaccine in a clinic that is special to be prepared to administer adrenaline if necessary. Okay, so coming back to Carol's question, when will I be able to return back to a normal life? I'm hopeful that by the end of 2021, we'll be able in the United States to resume back to a normal life. But the truth of the matter is we really don't know how this virus is going to mutate and if it's going to lessen the efficacy or if the virus itself will mutate even more to a more virulent, more disease-causing virus. So I'm hopeful that by the end of 2021, we'll resume back to a more normal life back here in the United States. But again, we need the cooperation of everyone. This is a community disease. We need the cooperation for people to wear their masks and practice social distancing. We need the cooperation of people to get the vaccination based upon science and medicine. If you have questions about getting a vaccine, ask your pharmacist, ask your doctor and nurses. They have the information necessary to relay that information to you. But we know that the vaccine is relatively safe. And again, at Pharmative, we always talk about the benefits. Here, the benefit is 95% reduction in you getting symptoms of COVID-19 versus side effects right now are limited to allergic reactions, which can be managed. Okay? The risks are death and significant morbidity with lung toxicity, cardiac toxicity, brain toxicity, chronic fatigue, confusion, clotting disorders. The benefits far outweigh the risks, and the cost should be free. It's, to me, a very clear-cut medical decision that when the vaccine is available for myself and my partner, Jimmy, we will get the vaccine, okay? Whether we get the Pfizer vaccine or the Moderna vaccine, either one is equally efficacious. That's all you really need to know. Your pharmacists and your doctors will take care of the rest for you with your nurses and your healthcare teams around the United States. And when you have the opportunity to get the vaccine, seriously consider getting the vaccine. You don't want to get COVID-19, and you want to prevent the spread of the disease for society to get back to normal. That's all we have for today for Pharmative Live. I see a number of people have signed on. They have Madonna and Jimmy and Steve and Jane. Thank you for joining us today. I will make this video available online shortly after today's program. And then always you can get all of our Pharmative Live and our Pharmative videos either on YouTube, on our page on YouTube, or through Pharmative.com. So in the meantime, until I see you next week, stay healthy because it's easier to prevent disease than to treat it. And that certainly is very true for COVID-19. And get your vaccinations as soon as you can. Again, in order to prevent the spread of disease, it's important. Thank you, and I'll see you next time.